Welcome to Hitting Home. I'm your host, Megan Driscoll.
And I'm Becky Coletta.
And we are here to break down how decisions in D.C. affect our local communities.
Because all politics are local politics.
Welcome back to Hitting Home with Megan Driscoll and
Becky
my co-host,
Coletta.
Becky Coletta. Excited to talk about biomedical research, which you may think is a very boring topic.
Not at all.
Not at all for Massachusetts, because biomedical research is incredibly important to our state, and so I'm hoping we keep it interesting. Okay, so let's just start off with basically, let's just talk about how this gets funded. So the NIH is a division of Health and Human Services.
It's National Institute of Health.
Yep, and the National Institute of Health is the largest public funding source of biomedical research in the country. Okay. The other thing about the NIH that I learned in doing the research for this, which it's something you just don't really think about when you think about money going to universities that's funding research that turns into a company. That company then sells a drug. Like that's sort of how you think about it going. But the NIH funding is actually a financial investment. So less than 1% of total budget goes to the NIH, but this small investment so 1% of the total federal budget actually on average returns $2.56 of economic activity. So it basically gains by 250% for our financial.
Well, and when you think about it, it kind of makes sense, right? Because you're funding people, you're funding institutions that then hire people to do like construction contracts and the like.
Right.
You're hiring researchers. I mean, it sort of
taxes, commercial
flows
taxes.
down, right?
Yeah, it's so interesting.
And it saves lives.
The added,
right?
The added benefit. Okay, so the NIH actually supports, like we talked about, it supports universities, hospitals, research institutions. It actually supports businesses as well. So biomedical research goes actually to fund programs within for-profit organizations. And in 2024, the NIH directly supported 500,000 jobs in the country and generated $1 billion worth of new economic activity in the United States.
Right.
So this is a economic engine of our country, and
I was looking at one site that was saying that in Massachusetts we could lose like $1.5 billion and something like 6,400 jobs.
It's actually higher than that. So the number is actually much higher than that. But if we talk about just
that was
generally,
kill the cuts.
Yeah,
I was looking at.
Yeah. So over 1 million lives have been saved by the NIH. There are 450, this is just in the last decade. So in the last decade, 1 million lives have been saved from the NIH-driven cancer research, which is, we were talking about that before the show. 450 new FDA drugs approved. 370,000 jobs are supported by the NIH every single year in the country, and over $750 million in economic activity. These are just some numbers that I found staggering.
Well, and people should understand that the NIH process over time has gotten so much more competitive. My sister is an epidemiologist, which means she studies epidemics or disease. And she graduated, she came from a small college in New Orleans and got to go to Yale. And she got her PhD from Yale. And then she worked for a research center at Yale for many years. And when she came out of her program, probably 30 years ago, she was, if they put in a grant application, they had about a 25% chance of getting funded.
Right.
And this was with a major research center. And then now I think it's down to something like 9%.
Yeah, well, even before what is about to happen.
Even before what's about to happen.
Yeah.
So it's gotten so much harder for medical research to happen. And the other thing,
There's a lot of people vying for that money.
A lot of people vying, and I think also people don't realize that to get that money, you go through not just the people at NIH who review it, but usually there's a peer review process. Like my sister has been on panels to review other people's applications.
Right.
And so you have to show that even if it's not, we do foundational research too. It may not, which is why it can't be private funded, because it may not produce a drug for 25 years, but it's the precursor to coming up with a treatment or a drug or understanding a disease. And it's already so competitive, and this will hurt us in ways that I don't think people really appreciate.
Well, the other thing too that I think is important when we think about like the cuts have been guised as waste, fraud, and abuse, right? And so, but these cuts don't actually make any sense because This is, like as you said, highly peer reviewed, very difficult to get these grants. You really have to prove that what you're going after has some sort of benefit to humankind, right? And so we're just cutting these for the sake of cutting them, and we're actually going to end up spending more money than we're going to save, it looks like. So since January, the Trump administration has sought basically to cut back on all of its funding. It actually tried to, and you've probably heard this in the news, and this is where it gets a little confusing, but they actually stopped all funding. So what that meant is that even for contracts that were to be paid out in 2025, he wanted to stop those entirely. The problem with that is that that monies was promised to these organizations for which they had research ongoing, staff, all kinds of things happening.
People getting treatments.
Yeah, exactly. People in clinical trials. It would have been completely chaotic. It's cruel, actually, to be honest. And so a variety of attorney generals, including the one from Massachusetts, said, no, you can't do that. You can't stop midway through. And there's been a pause on the stop of that funding. But that really only applies to funding that's already been given out or promised. It doesn't mean that they can't stop future funding. And so the proposal at the moment, if we just talk about monies that go through the National Science Foundation as an example, so their budget, they would like to cut from $9 billion to $3 billion moving forward. So that's cutting 66% out of the National Science Foundation budget.
And that's the real foundational research, like the things that sound sometimes funny, but they are programs that might produce the foundational science that's going to find a special cell or that's going to identify the source of a disease or a problem.
Exactly. Their charter is to advance the progress of science for health, prosperity, welfare, and national defense. So they do a lot of national defense work as well. A lot of the work on anthrax comes out of this organization, things like that. So right now, the funding halt has been stayed for now, although it's sort of an initial success. It's very up in the air with what will end up happening moving forward, and the Trump administration has said they're going to appeal that ruling as well. So let's talk about how the NIH funding trickles down to Massachusetts, because, and I don't think anybody would be surprised necessarily to hear this, but Massachusetts is the largest recipient of NIH funding in the country.
Which is why we have MassGeneral and Brigham and Children's and Dana-Farber. Yeah. And all of these, Mass Pioneer, all of these institutions that do cutting-edge delivery of services.
It's the reason why we're the number one research, and place to come. People come all over the world to receive treatment, especially when we talk about entering into clinical trials. I think we're the largest clinical trial part of the country. So for novel development of drugs for people whom have no other choice, right? No other option. It's sort of a death sentence, or come to Boston and try this, this new drug out. It's actually $3.5 billion annually that we receive from the NIH. $3.5 billion.
And they're talking about cutting what, half of that?
66, more than 66%. So the economic impact is going to be huge and substantial. So we think it's been estimated that funding actually funds 7,000 jobs in the Bay State.
Well, and I think that it's important to think about those jobs, right? Because it's partly, I don't know that people understand or care as much about a doctor losing some funding because they feel like, oh, well, they'll just make it up in other ways. But it's also the lab technicians.
Oh, right.
It's also the people who clean the labs.
Yep.
It's also the people who, the research assistants who go out and interview people and administer drugs and take information. Those are not necessarily highly paid people. It's also the fact that these labs are constantly being redone or new buildings being built. So when you think about the building trades, the building trades might feel like, well, medical research doesn't affect me. But if you're in the building trades, it affects that whole industry because, electricians and plumbers and, carpenters are the people going into these institutions, and constantly there's work. If you talk to any of the people in unions, they're constantly getting work at like MassGeneral or Harvard or one of these research
Vertex Pharmaceuticals or Pfizer.
Right.
Right. I mean, we have one of the largest, and when we talk about biomedical research, I actually think we often, when we think about biomedical research, we think about our biopharmaceutical industry, which of course we are a stronghold for that. But we're also talking, it's the universities and the hospitals as well. It's really combined. And I don't think anybody could deny being in downtown Boston and not seeing the influence of the biopharmaceutical industry on our state. And what we're talking about is 60% of funding going away. That's
well, and when I look at it, I heard Senator Markey was talking the other day about sort of the business cycle in Massachusetts and how we draw people here with the research in the institutions. We give them really highly qualified workers because we have a good educational system. And then we try to encourage them to stay and take what they've learned by going to Harvard or whatever, and stay and build on the research and build a company and build the biopharma industry. So it's not just, if you take one piece out of that, how do you attract the rest of it here? How do you even attract the private here? People are coming here to begin with because they're starting at the research level.
Well, also, it's just an attack on science.
Right.
I mean, truly, it's just an attack on science. And so you're going to see companies not grow here, and not grow in the United States, and not grow in Boston. There doesn't seem like there's much of a future when you're reducing your funding by such an enormous amount. I mean, we're talking about taking 60% of the funding out of the system. I mean, that's an incredible amount of money.
And they were saying that like a company like Vertex and cystic fibrosis applications, that research apparently goes back 25, 30,
Decades.
40 years, decades. And where they were identifying the mechanisms and the cells involved.
For people who don't know, Vertex Pharmaceuticals, I don't want to say cured cystic fibrosis, but
it's pretty close to it.
Substantially changed the lives of cystic fibrosis patients to the extent that they were living on borrowed time and now are living full lives. I mean, it's a complete and total game changer for anybody who has cystic fibrosis. It was a breakthrough medicine. Actually, I happen to know the woman who worked on the product because I worked in the biopharmaceutical industry for 20 years. And it's been life-changing for so many patients.
So we have a close family friend who, he's a couple years younger than my son. And so we've watched him basically grow up, and he had cystic fibrosis. And every time he hit a milestone, they were coming up with a new drug for his milestone, or a new approval for his milestone. So when he hit 12, the most recent drug I think came out, he's maybe, and he went from really being more affected by the disease.
Yeah.
Although he did a lot better than people would have done 20 years ago because of these drugs. And now he's grown tall.
And he's on the Vertex drug.
He's on the Vertex drug.
It's made an enormous difference.
I can't tell you, just watching him and how much it makes you feel so happy that we've invested in something that changes lives.
Well, and I'm not sure we can quantify the loss of that too, right? It's like we recognize it when it's happening, but are we really going to recognize it when it's gone? That's the thing that I think we're missing, that you get diagnosed with something and the potential to save your life was there and may now not be there. Do we really recognize that? And I hope we do. I hope we think about, cystic fibrosis as a really good example, and even just the development in cancer research. And so,
well, my sister has Parkinson's.
That. Oh yes.
And they just announced maybe a pullback on one of the projects involving a possible identifying the way Parkinson's works that might lead to a treatment.
Yeah.
But again, we're not taking away a treatment, so people may not see it in real time.
We're taking away the research that leads to the treatment.
We're taking away the research that leads to the treatment.
In every area. It's cancer, Parkinson's, Alzheimer's.
And my sister has Parkinson's today.
Cancer. Yeah.
Like, I don't have time to wait.
No. None of us have time to wait. That's why it's so confounding. This doesn't make sense. Okay, so let's just talk specifically about some of the organizations in the state that are going to be hit. So MassGeneral, Brigham and Women's, it's the largest national hospital recipient of research grants beyond any other Massachusetts university or hospital. They've had tens of millions of funding canceled. They are shutting down their medical research programs in areas such as primary care, reproductive care, and pandemic preparedness. I want to talk about those specifically because of the reasoning.
Yeah.
So one of the issues, one of the reasons why the Trump administration is saying that they want to pull back on these things is this DEI, right? So they are pulling funding from programs that say woman or female. They're pulling programs that have anything to do with transgender, LGBTQ. Anytime you mention a subset of people that might be looked at or want to be looked at differently from a research perspective, which I think we could imagine there are a lot of reasons why we would want to look at a female body differently than a male body.
Well, for years and years, when I was first at the law firm, back in, worked at a big firm in the early 1990s, and we were taking on this project about funding medical research for women, because a lot of large-scale studies were excluding women back then because they didn't want to deal with the differences. They didn't want to deal with hormones.
To be honest, still today, if you were to look at the research,
it was really bad.
If you search menopause or you search Viagra,
right.
It's like 40,000 studies to like 200. I mean, I'm not giving you the exact numbers.
I know, but it's crazy.
It's crazy how little research has gone into women's health in general. And so now we're saying an all-out war on that. If you are doing anything related to fibroids, endometriosis,
which was
menopause,
preeclampsia was my sister's research area for many years.
Cervical cancer, uterine cancer, ovarian cancer. All of these things.
Well, the thing that we have to remember is, like, my sister studied preeclampsia because we had a good friend of the family who died in childbirth of HELLP syndrome, and it got her started on why are we still losing so many women in childbirth?
Yeah. Well, we're not.
And we still don't.
We're not leading in the world.
We still don't fully understand preeclampsia or HELLP syndrome, and what we still find when you get to the DEI issues is that women who are Black die at a higher rate in pregnancy in this country.
Yes.
And that's true across socioeconomic.
And women who are white die at a greater level than women in other countries too. So
yes.
We're not leading in this space even.
But we're now no longer going to look at why.
Right, exactly.
Any research that's directed at why, or calculating that difference between Black women and white women, is being defunded as we speak.
It's been defunded.
Yes.
And if the words female or woman are showing up in the research, that's where we're having these cuts.
Yeah.
Also, pandemic preparedness, because COVID's over, and we don't need to look at COVID any longer. Well, that's a huge issue because we have tens of thousands of people who have post-COVID syndrome, long haul COVID.
And we don't understand why.
We don't understand. We're starting to.
But we're going to get rid of the research.
We're going to get rid of that research. But more importantly, it gets rid of the research that we would need to have in place for our next pandemic to be prepared for that.
Right.
And if you think about the COVID vaccine was born out of work that was done on SARS as a pandemic preparedness project. The only reason why we were able to get a vaccine with the speed to which we did was because of the pandemic preparedness work that we had done previously. So we are just setting ourselves up for
a worse outcome.
A worse outcome.
And it needs to be.
And our outcome wasn't good. So I thought that was really, I just think it's really important that we mention the why behind this. There's the savings, the waste, fraud, and abuse, but this really is about DEI and taking kind of women out of the
and people of color.
And people of color. Yep. Well, and that's always been the case, unfortunately.
But it's gotten worse. We were actively working on research to identify why people of color have different outcomes in certain areas, and some of it goes back to maybe needing different treatment due to some, protein variances or small genetic differences. But part of it was also looking at the delivery of health services in our country, and we're saying no to all of that. So we're prioritizing the health of the majority over the health of the minority.
Yeah. Well, and we're prioritizing the health of men over the health of women. The full impact of the cuts at MassGeneral, I think, which have not yet, they're not clear. So there's more than $655 million in NIH funding that has gone to MassGeneral, and more than $380 million has gone to Brigham and Women's just in the last year. So what happens to the rest of that is really still up in the air. We know that the Trump administration is looking at another $9 billion in a multi-year funding commitment that it made to Harvard and its affiliates. So the affiliates of Harvard are Beth Israel, Boston Children's Hospital, and they are looking at pulling that money because of their opinion of how Harvard reacted to the anti-Semitism that was occurring on campus. So they are conflating medical research to the tune of $9 billion.
Well, and how much of this is also just political? Like you're going after large elite institutions in blue states.
Correct.
So let's just be honest that some of it is just politics.
It's ridiculous.
It's ridiculous politics because I'm thinking about someone we both know who has multiple myeloma. And she has the possibility of a cure of this cancer which killed my mother-in-law because of research that is coming to the fore in clinical trials within the last year or two. I mean, this is cutting edge cancer cures and cancer treatments that we're going to lose at these institutions like Harvard.
Yeah. Well, they're already losing it. So they've already canceled funds for the last 2 years of a 5-year study. They are losing a $10 million flagship program that was pandemic readiness. This is happening at Harvard and Beth Israel and Children's Hospital. Yep. So we also have millions more dollars being cut from the University of Massachusetts Chan Medical School, Boston Medical Center. Many of these labs are reaching out to the NIH and trying to appeal these decisions. But in the meantime, their money has stopped coming in.
Well, and so some of the labs have announced, some of the professors have announced that they're going to shut down labs in order to preserve like existing cell lines and existing research. Consolidate, or they don't want to go down a new path and then lose all of that work. So they want to really focus on trying to finish up some work.
Yeah.
And I think we're going to start to have people who are going to look to go to other places.
Yeah, and I think that's one of the other things that doesn't make sense about this is this taking away money before findings have been presented. So essentially, it's a waste of money. It's not there's no return on your investment. So we've basically said you've got this grant. You're coming to the end, right? You're maybe finishing your paper. Or
might be a 5-year study.
Right, year 3 or year 4, and they're canceling it. So the money's just all have been spent for naught. There will be no paper at the end of it. There will be no conclusions. There will be no findings.
Right, so you have all of this data collection that's going to sit in a vault.
Exactly.
And maybe be used one day if we actually get away from this nonsense and get back to some actual science funding and get serious about science funding and medical funding again in this country.
Yeah. Boston Children's had 5 grants terminated already. They total $11 million. From what we are hearing from scientists who are working in these institutions, they are frightened. They are scared of what the future holds for them. And it's a very scary time out there. In fact, actually, I think you can find this, and I'll put it in the show notes. 2,000 scientists came together and wrote a letter to the Trump administration and to the NIH, just expressing their concern over what they're seeing as just an obliteration, their words, not mine, of medical research in this country. So this is like, we're in uncharted territory.
And you already hear about a few people going to institutions in Canada or trying to get accepted by research institutions in the European Union. We really aren't going to attract the same people to Boston and to the United States that we have in the past because people can't trust that they're going to come here and be able to finish their work.
Yeah, and you have to kind of,
like why did Einstein and all of these people choose to do the work in the U.S.?
Well, yeah, we're no longer going to be a leader in the world of medical research. That's clear. We're headed in that direction, for sure. And that's not me saying that. That is what professors and leaders of research are saying at these amazing institutions that we have here in the city. And I think people are a little frustrated from what I can gather from what I've read about this and getting ready for this and reading the letter the scientist wrote.
And knowing what you know about the biopharm industry.
Yeah, which I was in for 20 years. I am concerned that there's not as much of an uproar. And I think they're concerned that there's not as much of an uproar about this. Now, we did have some, I think there's protests happening. There's, that's been ongoing and whatnot. But this is going to affect not only our economic situation in Massachusetts, on top of what's happening in the stock market, and we're going to be headed into a recession, they're saying potentially. We're going to have those headwinds, but now we have a manufactured problem with our economy because we're pulling all this money out of biomedical research, which disproportionately hits Massachusetts. I think it goes back to this like war on the blue states, right? And you have to ask this question.
And war on science. I think it's a war on the blue states and a war on science, and I don't know why.
Yeah,
I really
know
don't.
Why. Control.
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 Also, I think that there was this sort of backlash to COVID and the decisions made in COVID that needs to be part of the conversation. We need to talk about it more. We have like two sides, and we need to kind of get back to having conversations about that.
I think scientists would disagree that there are two sides.
It's interesting.
We just have to be careful with that.
It's not an equal, right.
I mean,
there's a lot of misinformation
out there.
Misinformation.
Let's put it that way.
I will say that. Yeah. I agree with you on that. But we have to talk about it. We have to hash it through and help people understand what the science says about that.
Yeah, exactly.
How we saved lives, and whether it was worth it or not, I don't know. But I know we saved lives.
Yeah.
I know we saved a lot of lives. My parents are 89 years old. They didn't get COVID until after they were vaccinated, and after we understood a lot better how to treat it.
And my mom got COVID before there was the vaccine and was on a
respirator.
Yep, and did survive, thankfully. She's the mom that has like 9 lives. She can survive anything, it seems. But she was actually the first patient on a ventilator in the South Shore, interestingly enough. Okay, so I think the question now is that we should just sort of sum up with. Is what can we do about this, right? Like what can the average person do about it other than we can lament on how horrible this is?
Well, and share information.
Yeah. So I think we talked about kill the cuts seemed to be a really focused on the science, has a labor component to it. So it's killthecuts.org. They organized an event in early April. They'll be taking the lead on organizing future events. Our call to action is to head to their website, sign up to learn more. There's actually a section in there. It actually has a wealth of information too.
Yes, it really
about
is.
This topic. So if you want to know how it's affecting not only Massachusetts, you can actually go there and look up any individual state and get a better idea as to
what the impact is in your state.
Is in your state if you're listening not from Massachusetts. But it also allows you to organize by location. So you can actually type in your address and then it will kind of hook you up with events that might be happening in your area. But I do hope that this is something that, particularly for Massachusetts residents, because it affects us so greatly, that we take a special affront to this injustice against not only just science, but our economy. At large.
It's science, it's health, it's economy. It is, it's crushing to think of what we're going to miss out on. And it both in terms of an economy that serves the world in so many ways.
Yeah. And
the health issues.
Yeah.
It just kills me.
I hope we have the appreciation for what's been done for the family and friends that we know of who've been affected by great medical breakthroughs, and we recognize that has been slowed, stalled, and halted in some places entirely. And I just want to put an actual point on this, that medical research as it relates to women in general has been lagging substantially. Nobody will argue about that. And I feel like we had just started talking about how important it is to research some of these very specific things that affect only women. And it just breaks my heart that we're not only not staying still, we're actually going backwards. We're canceling projects that are focused on women's health. That is mind-blowing to me. So Kill the Cuts, we'll put all of this information in our show notes. And thanks for joining us, and we will see you next time.